Dear colleagues, I'm Christoph Diener from the University of Duisburg-Essen in Germany, and I would like to report what my literature search in September 2022 showed. The first and most important message was not published, but this was a press release by Biogen and Eisai. And they reported the results of a study in patients with mild cognitive impairment and incipient Alzheimer's disease and beta amyloid shown by amyloid PET. This study investigated a monoclonal antibody against beta amyloid called lecanemab and compared this with placebo. The drug was given with 10 milligrams per kilogram every 2 weeks. The study overall had 1,795 patients, and the primary endpoint was the clinical dementia rating sum of boxes. The study was positive. For the primary outcome, there was a difference between active drug and placebo of 0.45 points, and this translates to a 27% risk reduction for preventing the progression of the cognitive impairment. The study was also positive for the amyloid PET, showing that less amyloid was seen in the active treatment groups. The study was also positive for the secondary endpoints. This is a major breakthrough if the results are also shown in the final publication. The problem are adverse events, and the study showed the typical adverse events of these antibodies, which is brain edema in some patients shown on MRI, and microhemorrhages and also bleedings into the brain. And we have to see, because the study was only 18 months, how these side effects develop if a patient is treated for several years. The second study was published in Nature Medicine, and this study looked at the neurological consequences of COVID-19 infection. The study had 154,000 people who had COVID-19 infections, compared with 5.6 million controls and a follow-up of 12 months. And the study showed an odds ratio of 1.42, which is a 42% increase in the risk of neurological diseases after COVID-19. And this includes stroke, cerebral hemorrhage, cognitive impairment, memory dysfunction, polyneuropathy, migraine, epilepsy, disease of the musculoskeletal system, IEDP, and encephalitis and encephalopathy. Well, the study was only done in Caucasians, but I think it can also be translated most probably into other people. And this shows that neurologists have to know the possible neurological consequences, long-term consequences of a COVID-19 infection. The next spectacular study was published in Brain. We all know that misfolded alpha-synuclein is an important factor in the progression of Parkinson's disease. And until now, it was only possible to show this alpha-synuclein in CSF. And a group in Kiel in Germany has now also shown that they can show increased misfolded alpha-synuclein in plasma. And this will be very important to identify patients in future who could go into randomized treatment trials. My next study was on asymptomatic carotid stenosis, and a research group in Heidelberg in Germany published the 5 years results of the SPACE-2 study. This study included 513 patients with asymptomatic carotid stenosis and randomized them to carotid endarterectomy or stenting plus best medical treatment against best medical treatment. The primary endpoint was stroke or death within 30 days or ipsilateral ischemic stroke in 5 years. And there was no difference between the treatment groups. And my understanding is this means that patients with asymptomatic carotid stenosis should receive best medical treatment. And only the ones where it's not possible to control risk factors and concomitant diseases could undergo interventional treatment. Let me come now to secondary stroke prevention with anticoagulation. There is a very rare inherited disease which are people who do not have the coagulation factor 11A. And these people have a decreased risk of stroke and myocardial infarction and only a very small increased risk of bleeding. And therefore, drugs that inhibit factor 11A were developed like asundexian, which was investigated in people who had a non-cardioembolic ischemic stroke. The study was published in Lancet Neurology. The study included 1,800 people and treated them either with 10, 20, or 50 milligrams of active drug or placebo, and the patients were followed for 26 months. The primary endpoint was clinically silent infarcts on MRI and clinically apparent ischemic strokes. Unfortunately, there was no difference between active drug and placebo, and this was mostly due to the fact that the lacunar infarcts were not prevented, which I think is logical because anticoagulation does not work in preventing lacunar infarction. The Bayer company, however, announced they would do a further phase 3 study in a selected group of patients where they hope to have a better result. And my final study is a study which looked at the initiation of NOACs in people who had an ischemic stroke and atrial fibrillation. The timing study, which was published in Circulation, recruited 888 patients, and they were either anticoagulated with the NOAC within 4 days or between 5 and 10 days. And the primary endpoint was a recurrent ischemic stroke, intracranial bleeding, or mortality within 90 days. Statistically, there was no difference, but there was a strong trend towards benefit in people who were treated early. The good news is no single patient on a NOAC had an intracranial bleed within 10 days. Ladies and gentlemen, spectacular new studies which came out in September 22. I'm Christoph Diener from the University of Duisburg-Essen. Thank you very much for listening and watching.